So how has like all this stuff impacted occupational therapy, all these trends and exploding costs in healthcare? So some of the things we're seeing in OT is these rising copays, especially in an outpatient setting. What are copays? That's the amount that the insurance, in this case, generally Medicare and most private insurances doesn't pay. It's usually around $20 a visit, upwards towards $40 a visit, $40 to $50 a visit. So what that means, even if you have good insurance and you go to outpatient occupational therapy, you could be spending, on average, probably around $20. So how many times are you going to be going to OT in a week? Twice a week is $40, and over a number of weeks, it's hundreds of dollars. So the patients that need intense, high-visit therapy kind of get left out in the cold because they just can't afford it. Productivity. It seems to be like they're expecting more and more out of the therapist in terms of how many patients you see a day and what is your productive time and all that sort of stuff. A lot of more and more part-time work, it seems, for therapists. It's cheaper for the company to hire you part-time. They don't have to pay the benefits, so there's more and more of that. Contractual companies are working in nursing homes and schools and skilled nursing facilities. Less visits, they're expecting more with less visits. That seems to be the common continuing trend around all areas. As a result of this, less visits kind of thing, less money, higher copays. There's a rising unmet need for OT, especially in pediatrics, chronic neurological kind of issues we talked about, and mental health issues due to the lack of reimbursement. And there's opportunity there for private pay or other means because insurances are paying for less and less, basically. New billing trends for skilled nursing facilities. It started recently. Reduced therapy reimbursement, so they're paying less than they used to pay for therapy. Paid kind of more lump sum versus per visit or per minute or unit. Not paid more for having OT. We used to be like the golden child. They wanted OT in there because they got paid more from the insurance company. That's no longer the case. So more and more so, we really have to justify our worth, justify your worth to the managers of the powers that kind of run things, articulate why somebody needs OT, why it's so important. We all know it. We have to kind of get good at saying why we know it. Merit-based pay. This is starting a new trend. That's a good thing, really. It's just kind of starting, really hasn't taken off yet. What this is about is getting paid more for outcomes, how your patients do versus just seeing your patient or how sick they are. In home health, they're kind of lumping things together more with these, what they call DRGs, which is basically a lump sum payment for, again, how sick you are, what your diagnoses are. Home health they're kind of comparing the outcomes of agencies, again, pushing that outcome kind of thing. Accountable care organizations, you may have heard of these. What these are is grouping everybody together. So they give the hospital, say Northern Light, a lump sum of money and say, this is how much you've got, pay for all of it. Pay for the hospitalization, pay for the rehab in the nursing home, and to pay for home health, and potentially outpatient. So who's can get the best at doing this the most efficiently in terms of the less utilization or less visits of services, therapy services, and get the best outcomes. So they're getting paid by outcome and money. Basically, it's pushing quality and less cost is the idea of it. Compassion education is another trend, new idea. As we've been talking about, they're seeing quite overwhelmingly now that clinicians, therapists, doctors, nurses are more empathetic with their patients. They get better health outcomes. So they're trying to train healthcare workers to do this. Stories like you've done, simulation, that sort of thing. Evidence-based practice, you get a lot of that in this program as well. That is a new trend pushing therapy that we know it works. Person-based technology, we talked a lot about that with the smart homes, the apps, versus kind of reimbursement-based technology. Chronically ill programs, the video, the homework assignments about that. That's a growing thing, a growing need in therapy. Interprofessionalism, the more we can talk with each other, the better. We're getting a lot of that in this program as well. What do patients want? Empathetic doctors who listen. It take more than 18 seconds to hear their story. Communication amongst workers. Healthcare that is affordable, that works, that's evidence-based, that keeps people in their homes. That's where they want to be. They don't want to go to a nursing home, that sort of thing. Effective, comprehensive healthcare for the chronically ill. Telehealth. I don't need to spend much of this. We could have talked a lot about this. You've done all this. A lot of telehealth for pediatric programs. Chronically ill, there's telehealth. And the good news is we're getting reimbursed for it now. So it's one of these new things, address this unmet need through therapy. So the Hotspotters, what that's about is about this great program in Camden, New Jersey, where they started to serve the chronically ill that were costing the system, the hospital, so much money in a different kind of way. How was it different? Emphasized a lot more care, a lot more listening, a lot more empathy, really, keeping on top of symptoms before they kind of get out of control. And I think there's a huge role for OT in this. They don't talk about OT, but I think it's easy to see. So what you need to do is just watch this video, it's not very long, and answer these questions for your in-class assignment. Do this individually. Lastly, just kind of talking about poverty, leading up to the homework assignment, the story that you read in the PBS video on pediatric poverty. This is images from poverty in Maine. This is kind of what I saw a lot of in home health, a lot of poverty in Maine. It's overwhelming and quite eye-opening when you actually see it. A lot of us kind of grew up in good households and that sort of thing. That's why we're here, I think, for the most part. So it was very eye-opening to me, to say the least. In Maine, there's kind of two Maines. Southern Maine is where a lot of the money is. Northern Maine, Western Maine, East Maine, a lot of poverty. Oxford County, that's where I grew up, a lot of poverty. Penobscot, Washington County, a lot of poverty. Nearly 1 in 4 children in Maine under 5 grows up in poverty. These are the kind of kiddos you're seeing generally in the schools, a lot of the health issues, this connection to poverty and the ACE scores and all that. Dramatic rise in child homelessness in Maine. Teen pregnancy, single parents, a lot of poor diet, living health issues. We'll talk about child rearing. I think can make a big difference in terms of how the child turns out, ACE scores, drug use. That poverty leads to all these emotional, physical problems, academic struggles. It becomes very cyclical, kind of falling behind. Pregnancy, less income for the next generation, that sort of thing. These are kind of evidence-based traits in terms of what makes a very effective parent, in terms of the child doing well, and what makes a parent, children maybe not do as well around future child possibilities and health, that sort of thing. Doesn't necessarily mean that if you have one of these or all of these, that you're going to be, something wrong with you or kind of behind everybody else. But they have shown to be strong indicators of later on issues in an adult at the start of childhood. Teen parents, single parents, high stress marriage, financial struggles, a lot of changing in homes, not talking to your children. It seems like such a fundamental thing, but it's a very important thing. How you discipline your children, verbally versus physically. Home safety issues, basic things like secondhand smoke, asbestos abuse. Not reading to or electronics focused, then reading to your children. That's a huge deal, reading to your children in terms of brain development. And this is the opposite. The evidence-based traits of the ideal parents in terms of their children doing well in life. Home ownership. All this comes down to income. Home ownership, 2-parent household, middle class. The child is very busy in doing is the key thing, activities, being read to, being talked to, timeout disciplines versus physical discipline, involved parent, stimulating play versus just constant electronics, good marriage, empowering the children, making the children assertive versus passive. The discipline thing seems like a fundamental thing, I think, for all of us, but it's a huge thing in terms of future health issues with children. Non-physical disciplining appears to be connected to healthy, less impulsive, well-adjusted adults. Nurturing discipline, timeouts, explaining, negotiation, working on impulse control, teaching how to cope verbally, versus physical, healthy, unhealthy punishment, spanking, any kind of touching at all. Screaming, not good. This leads to the trauma that he studied, all these awful things that can happen. And you can see that the poverty, the overwhelming crushing poverty on these children, on these poor kids in the documentary, the lifelong impact of child poverty leads to lifelong psychological, physical health issue. It's very cyclical. You sense that in the documentary. Also, I thought on the positive side, you could see those children, their resilience, their incredible strength, I think. And you can see if they just get some kind of footing, some kind of stability, they can really start to thrive and do well. Some of the themes to the story, it was a very short story, but very typical of a lot of patients I saw with chronic health issues, chronic poverty, just getting kind of overwhelmed with life, that sort of thing. A lot of times, there really is no simple or easy healthcare solution. It's more management of symptoms. In her case, it was lupus. Talked about a lot of the chronic illnesses that can be very challenging. Small goals, making most of limitations. There is more reimbursement now for maintenance therapy. A lot of home health agencies are getting into that, trying to find some meaningful activities. Looking for supportive family, accepting limitations really as a therapist. And the upcoming assignments.